Welcome to this explainer. Look, today we're tackling a condition that is incredibly common, yet somehow deeply misunderstood. I'm talking about Polycystic Ovary Syndrome, or PCOS. If you, or maybe someone you love, is navigating this right now, you know firsthand just how frustrating the confusion and the sheer lack of clarity around it can actually be. So we're going to break it all down, look at the real science, and most importantly, talk about how to take back control of your health.
Okay, let's dive into this. 1 in 10. Just let that sink in for a second. That is how many women of reproductive age are affected by PCOS. We are talking about a massive, widespread scale here. This isn't some rare, obscure disorder. It's a major health reality for millions upon millions of women worldwide. So if you're dealing with this, you've got to know you are absolutely not alone.
Here's our quick roadmap for today's explainer. We'll start with the truth about PCOS, move into symptoms and causes, solve the diagnosis puzzle, cover managing through treatment, and finally, thriving and living well. The goal here is to take you from untangling those baffling symptoms to learning exactly how to treat them.
Part 1, the truth about PCOS, busting the biggest misconceptions. Because let's be honest, the very name, Polycystic Ovary Syndrome, kind of causes immediate confusion and panic right from the jump.
We really need to shatter these major myths right out of the gate. People often think PCOS means you can't get pregnant, or that it only affects overweight women, or even that weight loss is some sort of magical cure. False, false, and false. Now, what's really interesting about this slide is that despite the terrifying name, many women with PCOS don't even have ovarian cysts. Crazy, right?
So if it's not strictly about cysts, what actually is it? Well, medically speaking, PCOS is a condition where the ovaries produce higher than normal levels of androgens. You'll often hear these referred to as male-type hormones. When these androgens are elevated, they basically hijack the system and can severely interfere with ovulation. And it's that interference that leads to those hallmark irregular menstrual cycles and those super frustrating fertility issues.
Which brings us to part 2, symptoms and underlying causes. What is actually happening in the body? We know what PCOS is on paper, but how does it physically show up?
When your hormones are out of whack like this, it creates a massive domino effect in the body. And the symptoms? They are incredibly diverse and, quite frankly, deeply frustrating to live with. We're looking at irregular, absent, or unusually heavy periods. We're seeing physical changes like excess facial or body hair. That's called hirsutism, along with acne, thinning hair, and sudden weight gain, especially around the belly. It can even cause darkened skin patches on the neck or underarms, skin tags, and really significant mood changes like anxiety or depression.
But please, hear me when I say this. You do not need to have all of these symptoms to have PCOS. Every single woman's experience is totally unique. You might have just a couple of these issues, and I promise you that does not invalidate your struggle or mean your symptoms aren't real.
The exact root cause for all of this isn't completely ironed out, but we do know these 4 underlying factors are the main culprits. Genetics definitely play a big role. Then there's insulin resistance, where your cells basically ignore insulin, leading to higher levels that then trigger those excess androgens. And this brilliantly illustrates how, when you mix that hormonal imbalance with chronic, low-grade inflammation, you just get the absolute perfect storm.
Part 3, solving the diagnosis puzzle and why it can be so notoriously hard to pin down. It really is a puzzle. Mostly because there's no single simple blood test you can just go take to get a definitive yes or no.
Instead, doctors rely on what's called the Rotterdam criteria. Basically, they're looking for at least 2 of these 3 distinct signs. Step 1, irregular or absent ovulation. Step 2, signs of excess androgens, either through those physical symptoms we talked about earlier or via blood tests. And step 3, polycystic appearing ovaries on an ultrasound. If you meet just 2 of these 3, a doctor will diagnose PCOS. And they'll usually check your blood pressure and cholesterol while they're at it. Now, I am sharing this next part not to induce panic, but to really stress the critical importance of management. If left entirely untreated, PCOS carries some serious long-term health risks. We're talking about increased risks for type 2 diabetes, high blood pressure, heart disease, and even sleep apnea. And because of those infrequent periods, there's actually a higher risk for endometrial cancer, alongside the ongoing battles with infertility.
But that leads us right into part 4. Managing PCOS through treatment, taking back control of your health. Yes, PCOS is lifelong, but there are incredibly effective ways to protect your body and advocate for your own well-being.
So, lifestyle changes are very often your first line of defense. Now, let's be clear, there is no single magical PCOS diet. But look at these proven strategies. Aiming for 150 to 300 minutes of moderate exercise a week plus a couple days of strength training is massive. Get this, it actually improves your insulin sensitivity even if you don't lose a single pound. Pair that with staying hydrated and eating a balanced diet of high-fiber foods, whole grains, and lean proteins, and you're making a huge difference.
And hey, if you are overweight, losing just 5 to 10% of your total body weight can significantly improve your hormone levels and get those menstrual cycles back on track. This is a major reassurance anchor. You don't have to achieve some dramatic overnight transformation. Small, highly manageable goals yield absolutely incredible medical results here.
So the crucial point is that when lifestyle changes aren't quite enough on their own, doctors can target your specific symptoms with really tailored medications. For period regulation, they might use cyclic progesterone to protect the uterine lining. For that insulin resistance we keep mentioning, a drug called metformin is super common. Dealing with acne or excess hair, anti-androgens like spironolactone can work wonders. And for fertility, medications like letrozole are often the very first choice to help induce ovulation. It's all about targeting exactly what your specific body needs.
Part 5, Thriving and Living Well, the Path Forward. In this final section, we really need to address the absolute biggest anxiety surrounding PCOS management, fertility, and mental health.
Let's just read this question and let it hang in the air for a second. Can you get pregnant with PCOS?
Yes. The answer is a definitive, resounding yes. Many women with PCOS conceive completely naturally, and many others conceive with treatment. By managing your weight, keeping that insulin resistance in check, and working with your doctor to use those ovulation-inducing medications we just talked about, you significantly improve your chances of pregnancy. Please do not let anyone tell you otherwise.
It is also incredibly important that we talk about the mental toll. Women with PCOS experience much higher rates of anxiety, depression, low self-esteem, and body image concerns. Mental health is a massive, highly common component of this disorder. If you are struggling emotionally right now, please seek out counseling or join a support group. Tell your doctor. Your mental health deserves just as much attention and treatment as your physical symptoms do.
So, when is it time to officially take action? Here is a super clear, actionable checklist for you. If your periods are spaced out fewer than every 35 days, or you're skipping months at a time, see a doctor. If you're having difficulty getting pregnant, dealing with severe acne, rapid weight gain, really heavy bleeding, or showing symptoms of diabetes, like increased thirst or frequent urination, it is time to make an appointment. A gynecologist or an endocrinologist can create a customized treatment plan tailored specifically to your goals.
I want to wrap up our explainer today with this quote directly from the medical guidance. Although there is no cure, PCOS is highly manageable. Taking prescribed medications can greatly reduce symptoms and lower the risk of long-term complications. Honestly, this is a profoundly empowering note to leave you with. It is a lifelong condition, yes, but it is highly controllable when you take the right steps. Which brings us to our final question for you. How will you take charge of your health journey today? Whether you need to book that doctor's appointment for yourself, advocate for better care, or step up to support a loved one who's dealing with PCOS, the power to thrive is literally in your hands. Thank you so much for joining me for this explainer, and we will see you next time.